Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hey there, I'm Dr. Callerina Woodard, and today I'm going to be talking about a topic that I'm very comfortable with because I've been a chiropractor for well over a decade now, 12 years to be exact, and I hear patients complaining about low back pain all the time. So there are many different things that can cause low back pain. I want to get into what the most common main things I see are, especially since I'm someone who takes x-rays and does a very extensive evaluation. So we're going to talk about that. We're going to talk about the anatomy around low back pain, as well as the physiology around it as well. And then some simple things we can start to integrate to help patients get better. So let's get into it. All right. Like I said, all about low back pain here. Now, in most cases, we see that low back pain is a compensation issue. So when it comes to educating ourselves and our patients on that, we need to know what that means. When it comes to the movement of the lumbar spine, our lumbar spine is supposed to be relatively very stable. Now it does have some range of motion, but overall it's supposed to be more stiff and rigid. Most of our movement, rotation-wise, should come more from our thoracic spine, a little bit more in our thoracic spine, our hips, and then that stability in our lumbar spine is created by our core muscles functioning properly. And there's a physical therapist that I stole this quote from, and I use it on patients all the time, and that's the quote that it's always the victim that cries out, never the criminal. Now, in most cases, lumbar pain is secondary to some other system breaking down. That can be poor hip mobility, that can be weak glutes, tight hip flexors, weak core from sitting all day. These are things I'm going to talk a little bit more about. But just remember, pain in your lumbar spine is a symptom. So whenever that victim is crying out, something is acting upon it. And there are so many other things that are supposed to support our lumbar spine. Those are typically the things that start to break down. These are things like your lumbar erector spinae, your QL, your transverse abdominis, the adductors, your hip muscles, your psoas, which I talk about all the time. If you only knew how many times I've had to tell a patient, look up the word psoas. It starts with a P, but when it gets tight, it pulls on that lumbar spine, creating much more tension. And if it's not combated with a strong glute and strong, stable core, that psoas will just keep pulling, and it actually has fibers that connect to parts of our disc as well. So this can be all one big piece of the puzzle. Don't forget about our pelvic floor muscles. Right here I have an example of the female pelvic floor, but the male pelvic floor as well. That also holds everything in tight so that all of the compensation doesn't go straight to your spine. We're designed in a way that we have so many other support systems, but because of breakdown, a lot of the extra pressure gets put in our lumbar spine. Like I mentioned, that spine needs to be strong and stable. Everything else around it is stabilizing, and they're supposed to take the majority of the movement. But whenever that doesn't happen, pain, force goes into the lumbar spine, creating pain. So why does something like disc pain even happen? A lot of people don't know this. A lot of our patients don't realize this, but you're not born with a lot of pain receptors in your lumbar spine. Once we start to develop a chronic injury, there's just a very trippy alarm system that goes off. So what's really happening is you only actually have pain receptors in those, or the nerve fibers that are more on the outer annulus, not something more deep. But with injury and with chronic inflammation, that increases those cytokines that start to irritate the area and create new blood vessel, new growth, which allows for new nerve fibers to start to grow. And when this happens, the nervous system's alarm system becomes much more sensitive. This is what creates somebody to, once you have one bad low back pain, you go to bend over and pick up a pencil and you blow your back up, or you injure your back that way. It's because your disc really quickly sensed some sort of injury or input being put on it, and then that causes pain everywhere else. It's not how we're designed. It's more so a compensation. Whenever this starts to happen more routinely, adults, we start to create poor movement patterns. And this often is because of we're sitting a lot. So we're sitting a lot, we have those tight hip flexors, we have all the extra force and movement happening in our lumbar spine. We injure our lumbar spine, and then it just keeps happening over and over again. So what do we do to fix it? We have to signal safety and stability. Like with anything physiological, you have to signal safety in order for your body to recover, because it's almost like we ruin the trust when it comes to our lumbar spine. So our body says, I don't trust you to take care of this anymore because the mobility is poor, because you're putting all this extra force into my lumbar spine. So I'm just going to have this trippy alarm system. And then that's where we start to see these chronic injuries, this chronic pain coming about. Like I mentioned, weak glutes, tight hip flexors equal low back pain. That's the number one thing I see. Of course, core, how we're standing, because when we're sitting all day, we're not engaging our core the same way as walking or moving or lifting. Even if you do work out in the morning and then go sit for 8 hours a day, when you sit on your glutes for anything over 20, 30 minutes, you are shutting off blood supply, you're shutting off nerve supply to those muscles, and they do begin to slowly atrophy. This is also going to lead to a rotation in your pelvis, which puts even more stress into your low back. Your muscles aren't going to be engaging like they're supposed to, and that's where we start to see the more anterior hip movement. When our hip starts to go forward, that stance that you see, almost like people who either pull, they're like, they have a short, I wish I could show you me right now, but they have a shortened torso. They pull that belly button in too much and they tuck that butt underneath, or they go the opposite direction. Both of these are poor movement patterns for the pelvis and don't align the lumbar spine the way it should be, so that it can be as stable as it needs to be. This creates this weakness in our glutes, this shortness in our hip flexors, and then that's what causes more force to be put in your lumbar spine, which will eventually cause more tightness and more pain. Pain is a symptom. Typically, this breakdown in mobility and this breakdown in stability will happen first, unless there's a massive trauma, a kid tackled on a football field, something like that. The pain is typically because of this lower cross syndrome. Now, you've heard the tagline before, sitting is the new smoking. Well, honestly, just modern lifestyle creates anatomical dysfunction. When it comes to prolonged sitting, because of those short hip flexors, for breathing mechanics, because we typically round forward, and this goes with upper cross syndrome as well, but we're talking about the low back right now. So that poor breathing mechanics, because we kind of cave in on ourselves, we don't get the full expansion of our lungs, we don't move our thoracic spine. So we have poor thoracic mobility, and that shifts the load into our lumbar spine. Also, we're not having strong feet or ankles. That can be because of the shoes we wear, or that can be because we're just not working on that gait pattern properly, and that impacts everything upstream. A lot of cases, if someone has weak glutes, they're just not lifting well, they're not loading well, they'll have low back pain and also knee pain, and it's all related to sitting. Your body adapts to whatever you do the most. So if you sit all day, your body's going to get really good at sitting, and we don't need a super strong, stable lumbar spine if we're just sitting all day. So what are my favorite exercises when it comes to rehabbing the lumbar spine? If there were one thing I had to give somebody, it's going to be McGill's Big Three. Dr. Stuart McGill, most chiropractors know who that is. He is a lumbar specialist. He is the guy for weightlifters and for athletes. And when it comes to these 3 exercises, what they do is they create stability. When you do a bird dog properly, now there's so many videos about how to properly do a bird dog exercise. You reach and you create this tension throughout your whole body, because you reach fist to heal. You stretch your body, not really stretch, you just elongate your body and breathe through that, doing controlled reps. When it comes to the side plank, you're using and engaging that transverse abdominis muscle, so important for stability of the lumbar spine. And my favorite part about it is you're supposed to do a little bit of a twist, so movement along with this. And then McGill's curl up. So sometimes we will put one leg straight, but what you do is you plant your lumbar spine into the ground. I'll show patients this on a table a lot of times, and I'll tell them, put your hands behind your low back. I want you to imprint your hands into the table, like you were trying to stamp your hands onto the table. It's not a sit-up. It's more of a crunch. It's a curl up. So what you do is you push that belly button down, and that helps to rehab the psoas muscle whenever it's been too injured and it starts to shut down and overguard. Doing things like this, creating stability, is so much more important than just stretching alone. I see so many people come in and they're just trying to like touch their toes, they're stretching their hamstrings, they're just reaching overhead and going side to side. You have to create stability. You have to create trust within your lumbar spine before it will start healing. Now, as an athlete, I have injured my back before, and I can tell you the first thing I do is tell my muscles we're going to be okay. And I try to get those muscles to be able to be stable and strong again before I ever try to stretch anything. As much as I love stretching, as much as I love massage, as much as I love dry needling, we have to create stability first. Now, on top of the anatomical and mechanical piece, we do have to realize that there is some biochemistry involved as well. Back pain isn't purely mechanical, and I've seen this a lot too, because I see people with chronic inflammation, people with poor diets that is creating inflammation, people with poor sleep or sex hormones. I underline sex hormones here because I'm going to dive into a more recent example, but lower sex hormones, this all worsens your body's ability to recover and heal. Blood sugar instability, that's going to increase cortisol, which means your body is not prioritizing recovery, and then also increase inflammation, poorer recovery, or even things like chronic stress, cortisol as well, thyroid not functioning well, adrenal glands not functioning well. These kind of things will also create more pain syndromes. Now, typically it's more global pain, but it can also be localized low back pain if you've had an injury there before and you're doing all these other things right, anatomically, exercise-wise, but you don't have the chemistry part taken care of. We're going to see poorer recovery as well. When I mention hormones, I have a recent example. I had a patient who had been coming in for 6-7 months, and I had been giving him exercises. One, you know those people, just bad attitude. There was a lot going on. He had a very large belly. I could tell he had very weak glutes and legs. But then there were a few other things going on, and I tried to get him to do exercises. I tried to get him to create stability in his lumbar spine. The final straw was, let's test your testosterone. We tested his testosterone, and it was extremely low. And we had a conversation with him and said, okay, so there's the anatomical piece of this, there's the exercise piece of this, but there's also the chemistry, the physiological piece of this. Whenever you have low hormones, it's going to reduce your body's ability to heal. It's going to reduce your body's ability to create muscle that you need to support your spine. And it's going to also alter your pain perception and create more tendon and ligament damage because of that reduced collagen. This is all one big piece that goes together. So often we'll take an x-ray and we'll say, okay, it's just an alignment issue, but we won't take the whole patient into account. What are they willing to do on their own to fix their low back pain so that it doesn't come back? That's why I'm so big on education. This patient, I was like, here's all the information in the world that shows you why your back pain is still there. And then let me add another layer and say, physiologically, your hormones are causing an issue as well. And then what that does is in most patients it should, make a switch go off that says, okay, this isn't 100% a chiropractic problem. It isn't 100% osteopath or ortho problem. This is something I need to do for myself and take my whole picture health into account. Create strong muscles, create healthier hormones, have a healthier diet. These kind of things, I mentioned a male, but it's also very important for females. Whenever we start to lose our hormones and estrogen starts to drop, we actually will start to demineralize bones, our ligaments, and tendons will be impacted by this as well. So peri and postmenopausal women are also going to experience more pain, and it might not 100% be because they're not a good exerciser. I've seen, marathon runners and triathletes and CrossFit athletes who have pain, and it's because of hormones impacting sleep, impacting their gut health, impacting their recovery. So it's all one big piece of the puzzle, and whenever it comes to treating that patient, you have to treat them full picture. You can't heal without proper building blocks. And a lot of times we are nutrient and calorie deficient. Things like protein, having proper electrolyte balance, magnesium, omega-3s for inflammation, those micronutrients like even zinc and proper hydration are essential for growth and repair. The protein breaks down into amino acids. We have to have the sodium, potassium, chloride, calcium balance, and our tissue needs water. We're 70% water. If a patient is dehydrated, meaning they're drinking less than half of their body weight in ounces per day, if a patient is dehydrated, their body will steal from tissue to maintain blood volume. I've had these conversations with patients before. If you're dehydrated, your tissue is more dehydrated because long term it's going to start stealing, our physiology is going to steal water to keep our blood volume maintained, and it's going to take it from our tissue, it's going to take it from our joints. So this is going to lead to even poorer recovery and more pain and more inflammation. The amount of people I've talked to, they're only drinking 40 ounces of water a day. When it comes to healing, you have to keep it simple. You have to prioritize movement. Things like daily walks, getting up out of your chair, out of your desk, strengthening your glutes and your core muscles, working on hip mobility, thoracic spine mobility, and don't be afraid to get stronger. I used to think this was just a female problem. Men too. Don't be afraid to get stronger. And I know time is typically what most people say, like, I can't go to the gym, I don't have time. You can etch out 30 minutes a day before bedtime or as soon as you wake up in the morning or something to do exercises, glute bridges, McGill's Big Three, deadlifts, things like that, just to strengthen your muscles, give them the signal in the blood they need before you have to go sit all day. So often, too many people sit all day. So try not to sit all day. Get a smartwatch. Get something that reminds you every 30 minutes to stand up and just squeeze your legs. Even isometrics help so much when it comes to preventing low back pain and healing low back pain. You also have to improve your overall nutrients. Avoid ultra-processed foods. I now say ultra-processed foods because really it's hard. It's almost impossible for the average person to avoid processed foods. Ultra-processed foods, those packaged foods, those inflammatory foods filled with seed oils, filled with all this other junk and sugar impacting your blood sugar throughout the day. These are things that are going to cause more inflammation and impact healing. Drink minimum half of your body weight in ounces. Tell a patient that. See the looks that you get. How many times I've gotten the looks before of like, how much water do you want me to drink? That's the minimum. That's how much you need just to sit and lay in bed all day. You need more than that if you're exercising. We have to have water. We have to have the electrolyte balance. We have to have whole foods. And we have to stop chasing temporary relief. I don't want to get too much on a soapbox about this one, but as a chiropractor, nothing hurt me more than knowing that a patient thought that my adjustment was the only thing that they needed, or they just popped in just to get adjusted. Yes, I fully believe in the power of adjustments, but you have to look at your lifestyle. And you have to impact your lifestyle through these other things, not just this basic temporary relief of chiropractic, PT, other types of therapy, massage, or even just cortisone shots. These are all temporary relief factors that aren't actually fixing the root cause of the problem. Like I mentioned, pain is just a symptom. We chase the root cause, not just symptoms. So we first have to look at movement patterns, mobility. Whenever we have a patient comes in and they have low back pain, what are you doing all day? Like what does your day look like? Walk me through that. What is your inflammatory and recovery drivers looking like? What does your diet look like? What do your hormones look like? What is your age? What is your demographic? What could be also impacting your inflammation? And then, of course, the nervous system. How's your stress? Where are you holding your stress? Also known as all of these things together, we have to understand the patient's lifestyle because their lifestyle is going to impact their low back pain. It's going to impact pain everywhere, and it's going to impact their healing. Understanding low back pain, truly understanding low back pain, is so important when it comes to helping your patients heal because we have to be able to educate them on where their low back pain is coming from. More than just an x-ray or an MRI. We have to look at their whole lifestyle. We have to take their whole physiology into account so that they can not only heal quickly, but so they can prevent this from coming back. That's what I'm huge on. I don't want you to be dealing with low back pain for the rest of your life, on and off. Every year something happens. You have to teach your body how to signal safety so that your low back can heal and be strong and stable. I hope this really helps when it comes to talking to and treating your patients because at the end of the day, we just want people to get better. Have a good day.